Good afternoon, everyone. Thank you for joining us today on the 23rd of December. Truthfully, I think well, in fact, I hope you all know me by now, but I'm John. I'm the Chief Executive here at Sherwood Forest Hospitals. Today, I'm joined by Phil, our Chief Nurse, and Simon, our Chief Operating Officer. Delighted to have them with us today. We wanted to keep this on because it's really important that we continue to communicate across the trust, across the year, including during the festive period. I don't know how many colleagues will show up on the 23rd of December for various reasons. There's leave, it's incredibly busy across our organisation at the minute and other factors, but thank you for taking the time to join us. We're going to talk about a few things today. So I'm going to talk about some of the broader colleague updates, including staff Wi-Fi, parking, and some other bits. Simon's then going to talk about some of our access challenges and plans to bring down our waiting list over the next few months. And then Phil's going to talk about a few things quality-based like flu and other aspects as well. As ever, please ask anything you would want of us. It can be what's going on here, why have you made this decision? It can be controversial or non-controversial. It can just be, Phil, what's your favourite item on Christmas dinner? Any questions you want. We've had a few comments around this and we'll review Team Brief. We are reviewing Team Brief at the minute. So again, any feedback would be welcome to that end. You can raise questions anonymously if you wish. Or you can raise them with your name on. Any questions are welcome. As I say, you can raise them anonymously if you wish, and we will still answer them all. I'm going to take a little bit of a gamble at the end, and I'm flagging this now as well, though, in that I also think at this time of year, as we head into 2026, it's important, alongside the challenges we're facing, that we celebrate a lot of the amazing work that's going on across the trust. Straight before this, I was meeting our pelvic physio team. I've done some amazing work supporting women and men across the trust over the last year to have a better recovery from some of their procedures and otherwise. There's some amazing stuff going on across our trust. If you are willing to put anything in the chat about what you think the achievements that you, your team, or anyone across the trust have achieved in 2025 are, I would really welcome that, and we will draw attention to them and talk through them at the end of the meeting. So I'm signposting that one. You can put them in now, or I'll do a bit of a call out at the end of the meeting. It might be that nobody puts anything in there because I do know that it can be a bit intimidating writing stuff in front of whatever 50, 100 people. But I'm keen also that we celebrate a lot of the brilliant stuff going on across the organisation. So I'm giving you a fair warning of that one, and please do make this as interactive as possible. First of all, then, just a couple of updates from me. Again, thank you for the welcome. I'm a couple of months in now, and I must say Sherwood Forest is an amazing place, and I feel very privileged to be here. If I've not visited your area yet and you'd like me to visit you, please just drop me an email, a text, or pop up and see me. A couple of updates then. So firstly, staff Wi-Fi changes. We are improving our staff and public Wi-Fi. That journey has started. We migrated to a new supplier last week. So bear with us whilst we go through this transition period. We're confident the outcome of this will be a better Wi-Fi for colleagues and patients. We know that it's been imperfect over the last year or so, but this is a really important step forward for us. So watch this space. You will have to re-register when the new Wi-Fi switches onto your device. You won't then have to sign in every day. So if that's happening, get in touch with the service desk. It should just be a one-time thing. And then we'll be upgrading the Wi-Fi. So we'll have better performance, it'll be smoother, and all that other stuff that'll be better for patients and colleagues. So bear with us on the transition. As I say, you will need to re-sign into your device as and when that happens, and watch out for the comms on it. But it will be better. It's a real step forward for us. Point two, and I mentioned this one last month, and thank you to those that have checked their parking permit and reapplied if you needed to reapply. Again, I'm really sorry about this error of our supplier of parking and servicing that parking. They turned off some direct debits. Please, again, we've still got a big chunk of people that haven't done it. Please check that your parking permit is active. We'll get the link shared again this week. You'll get an email separately and individually if we still think you haven't activated it. Check it's active. If it's not active, you just need to re-enter your direct debit details. Any questions about it, again, go through our estates team, please. I am really sorry that I'm having to ask you to do it. It's just an error on behalf of our supplier, and they're very, very apologetic about it happening. To be clear, this is not about changing any of the volumes of applications or anything else. It's just simply an error from our supplier. Again, happy to take any questions on that if there are any. I'll pause there and check for a second if there are, because my computer's being slow. How pertinent with the Wi-Fi piece. Final point from me. Thank you for your hard work during industrial action. I know it was a really tough 5 days, a really tough time of the year. I think the work that colleagues did to keep our urgent emergency care pathways safe and to protect a huge amount of our elective capacity is incredible. When I walked around over those days, I saw really busy clinic areas. I saw people going over and above to make sure that people got the care they needed before Christmas. And having spoken to a lot of patients over that period as well, I can't tell you how much they appreciated it. We had people obviously waiting a long time to get an appointment for the care, and to get that done and seen before Christmas, no doubt we made a huge difference to colleagues' lives. So to patients' lives. So thank you for what you've done during that period. I think it was incredibly well handled, and I recognise it takes every profession and every service to help on that journey. I'm going to pause there. I'll come back to a bit of a summary later on, and including achievements and thank yous. But Simon, over to you.
Okay, thanks, John, for that. I was going to give a quick update on some of the performance areas across the organisation. I think if anyone was at the Senior Leaders Forum earlier this month, you'd have seen some of these slides. I'm going to try and share my screen. That could go quite wrong, but let's have a go. That's not work. Here we go. Oh, no, that's not working. I'm not going to be able to share my screen. Sorry, I can't do that well enough. I'll just go through some of the key areas of performance to update you on, though. I'll start with some really positive things. Our cancer performance, particularly around faster diagnosis, we're doing really well. So that's excellent for patients that we're giving them a diagnosis within the 28 days. So we're doing quite well with that. We're currently about 83% against a target plan of 77. So thank you for everybody's effort and hard work in delivering on those metrics. It's really pleasing to see us do well there. 62-day performance for cancer in terms of giving patients their final definitive treatment for cancer. We're about 65% at the minute. We have improved every month on month since earlier this year. So again, thank you for everybody's effort. We're still probably not quite where we want to be compared to other organisations nationally. But as I say, we are improving month on month around 62 days. So thank you for everybody's efforts on that. Other elective areas of note really around the size of our waiting list. We've currently got 36,000 patients on our waiting list. Now, that includes everybody waiting for first outpatient appointments, diagnostics and elective surgical care. So that's everybody that's waiting for those areas. The big focus for us as we move into 2026 will be trying to bring the size of the waiting list down. Our plan for the end of the year for March is to get it down to 33,000. The big area of focus for everybody is around first outpatient attendances. That's the biggest area of improvement we can make on that. So that's probably why you'll be hearing so much around outpatient transformation and the need to do try and reduce the number of follow-ups that we're seeing. If we can increase the number of first outpatient attendances that we're seeing, we should be able to bring the waiting list down to where we need, which is better for patients overall, and will reduce waiting time. So again, thank you for everybody's work on that. We just picked up some of the urgent and emergency care performance. People, I'm sure, on this call will know how difficult and challenging things have been across A&E and our urgent care footprint. There is some, good news in this, though, is that our performance so far this winter has been better than last year. So again, thank you to everybody who's working so hard to try and maintain performance. We're still struggling with number of patients waiting 12 hours in ED, which remains high. But we've probably got some extra capacity opening in a few weeks to help ease some of that into January. But our A&E performance so far, month to date for December, 65%, which is 2 or 3% higher than where we were last December. So again, thank you to everybody's hard work on that. Other areas to pick up, I guess, is length of stay. And I think as we approach Christmas, this won't be an unfamiliar message, but discharge is really important. We have seen our bed occupancy come down over the last couple of days. So please try again today and tomorrow. We need to try and get as many patients home for Christmas as we can to get us into a good place for Christmas and what will be a long 4-day weekend afterwards. So that's just a plea, I guess, for everybody that's got ward areas to just try and focus on getting people's discharge organised. If there's any problems with any complex discharges, please contact the IDAC team today and they'll try and support where they can. So if anyone's got any questions on performance, or happy to take some at the end.
Thank you, Simon. That's a super helpful and clear update. I've got 2 questions for you, if I may, and then I'll say something to give you at least 5 seconds to think about the answers to them.
Right.
So one is, what's your ask of colleagues going into what will be inevitably a tricky month at the end of December and January? And secondly, you've been driving down our waiting list for the last, 8 months or so now. What are we going to achieve in 2026? Look, I recognise across the organisation it's really challenged at the minute, particularly on our urgent and emergency care pathways, and that can have a knock-on onto our elective pathways at times. Again, we must always own, I've said this everywhere, we must always own what's happening in our organisation. We acknowledge that some people are waiting for longer than we would like for their care on both elective and UEC pathways. Our challenge, both for this year and next year, is how do we improve? How do we bring down those weights, and how do we show people that we are making progress and things are moving in the right direction? I think we can show that that has been happening. We've got to make sure we continue on that journey. Simon.
Okay, so I think to keep it broad and how everybody can contribute to improving, I think, a number of performance issues. For us, I know we keep talking about this, but it is discharge. And it's planning for discharge as soon as a patient arrives in hospital. Just to put it into perspective, about 85% of all the patients we discharge every day are pathway 0. So that's people not going home on complex pathways. So it's about 15 to 20% of patients go home every day on a complex pathway. So that's pathways 1 to 3. So that's either going home with a package of care to short-term residential care or long-term nursing home care. So the vast majority of patients we send home without any care needs, and it's those patients that we need to focus on getting their discharge organised, getting the patients down to the discharge lounge early on so we can ease some flow in ED in the morning. So that's probably priority number 1. The second priority from UEC is how we support the organisation to move patients through the organisation quickly. Our ED can get very, very crowded. The length of time it takes to move people from ED to the base wards can take a long time, and we need to try and find ways to try and speed that up. Just to put it in perspective, we had 217 patients in our ED last week, and I totally recognise the hard work that all awards, the clinical areas do to support that. But just in terms of focus into next year, that pressure probably isn't going to go away, particularly in the first 3 or 4 months of the year as winter pressures linger. So that's for that. And then in terms of elective priorities, I think for next year, as I've mentioned, we've got to bring the overall size of the waiting list down. We've done really well with that. I think we've made some good progress, but all the things you'll be hearing your divisional leadership teams talk about in terms of outpatient transformation, that's why that's number 1 priority for us on the list. We've got a significant amount we can do in reducing the number of first outpatients waiting for appointments. If we could get the treated, because there's quite a high treatment rate for patients who are seen as a first outpatient attendance. There's a lot of clock stops we can make there to improve the organisation's performance, and it's better for patients because they get the information they need to be able to plan their lives and move on with their care. So I think that's going to be a priority for us as we go into next year. And I think all those things are easily achievable if we maintain focus on that and the right level of focus across the ops teams on that. So I think they're the things you'll be hearing about next year.
Very clear. So flow through our organisation, flow out of our organisation, and let's bring our waiting list down. Again, we shouldn't forget the potential that the likes of our new community diagnostics centre, the new MRI facility, and other aspects that are coming online next year will have. I think it's an exciting time for electives as well.
Yeah.
Cracking. Thank you, Simon. Over to Phil.
Thanks, John. Good afternoon, everybody. Hope you're all well and getting into the festive preparations. I just thought it'd be worth giving you an update on the weekly respiratory virus figures. It's probably 3 weeks now since we reinstigated mask wearing in our admission areas. And in the last 2 weeks, we've seen a positive reduction in our figures of patients being admitted with respiratory viruses. So this week, just looking, we've got 22 patients currently in the organisation with flu, 13 with RSV and 4 with COVID. So we've seen a week-on-week reduction for 3 weeks, actually. So when we're trying to look for something positive, let's hope that we've seen that peak and we continue the downward trend. That doesn't mean we won't see all the peaks of that. And I suppose over this Christmas period, I've said before, a lot of socialising goes on and mixing. So I think it's really important you still think about, if you're not vaccinated, can you get vaccinated to protect your families and friends and others? And think about simple things you can do like hand washing, particularly when we're eating, having buffets, sharing food. We can see things like norovirus pick up over this period as well. So don't forget there's fundamentals that you can still contribute positively towards. In terms of mask wearing, we'll continue at the moment. We'll review this weekly, but I think it's still right to wear masks in our admission portals for the reasons we discussed before: undiagnosed patients, crowded areas, inability to isolate patients at that point in their admission. And I think we've seen this positive reduction. So I think you're all doing the right thing. So massive thanks to that. I recognise the challenge in wearing masks. It's not comfortable. We'll all think back to those couple of years during COVID where we had to wear them. There's lots of challenges to wearing them. So thanks for the way you've embraced it and done the right things. And I say I make no apologies for saying flu vaccine's still available. It's never too late. We could see further peaks of that. So I don't think it's improved the last 2 weeks. There's no point bothering. There's absolutely point. But thanks for what you've done so far. And then just to reiterate what Simon said, we've been out and about on the wards this morning. It was really positive to get some time with you all. Really impressed with all your Christmas decorations and some quite impressive displays on some of the wards there, which is great for your patients and for each other as well. So thank you for making the areas look festive. But I think the best way you can make people feel festive is get them home or back to a setting other than the hospital. So as Simon said, we really got to appropriately push getting patients out of hospital where we can. So any blockages, any barriers, things you think we can do to get people home, please escalate to your line managers, your teams, or up to myself and Simon if we can help. Again, we've been around, winter's not a new thing. We know that after Christmas we'll see another peak in activity, so we need to try and make sure that we're in the best position to cope with that when patients start increasing numbers through the front door for the reasons that John and Simon have already mentioned. So I think they're the focuses for this week from me. Vaccinate if you haven't already had it, please get it. Think about basic things you can do to maintain safety from spreading viruses, hand washing, wearing masks in the right areas. And that's not just at work, it's in your lives outside as well. And in your clinical areas, what can you do to get people back home to their families, loved ones, or wherever they reside for Christmas outside of the hospital, and help us be in a good position for what may come in the coming weeks. And hope you have a great Christmas. Thanks for all you do.
Thank you, Phil. It's always risky, this approach, but are there any particular wards or areas that you thought were particularly well decorated? You might upset people by not mentioning them here.
There was a very impressive, I'll probably get this the wrong way around now, I'm sure it was on Ward 34 where somebody had it looked like they'd stenciled a snow display on a window, but I think they'd sprayed it and then somebody had carved out a Christmas scene. Very impressive. Quite a lot of chimney and fireplace displays on wards as well. But Simon, you were with me. There are that many good ones, all blurring. I think Surgical Estec had some impressive balloon displays, not quite a balloon arch, but it was a happy Christmas in balloons. So yeah, good to see. Because if you are in hospital over Christmas as a patient, pretty miserable time. So I think we underestimate the importance of trying to make the environment good.
So honestly, I've been so impressed, and I agree. Surgical assessment, I think it was that we had Candy Cane Alley on Clinic 9. There's loads of others as well. Like it does make a difference to people. So thank you for that. Simon, did you want to flag any that have come to mind? It's certainly not my office, although somebody's dangled some tinsel on my desk. You'll be pleased to know.
No, I think I've been very impressed. I've been around the hospital this morning in general. It's good.
Thank you, and thank you for the comment from Morgan about our pelvic health physio service. As Morgan describes, it's a hugely expanded pathway. It's again, I was talking to Morgan before, and I've talked a lot about where we want to go in the future. Digital's a big part of our future, as is the integration of care, and it's another service that is integrated into our communities. It's a fundamental part of our sites here and at Newark as well. It's an all digital service, which really makes a difference to patients and our communities as well. So it's lovely to meet you and the team, and keep up the excellent work. I thank you again for the update, Phil. I promised at the end I'd come to give people the opportunity to write any achievements that they wanted to say across the year. Now, again, people might not put forward achievements here, which is part of my challenge. I would really encourage people in the comments, either anonymously or otherwise, anything that you think you and your teams have achieved this year. It can just be somebody you want to say thank you to because they've done an amazing job or they've made a difference to you. Could be something you've implemented, could be small, big, or otherwise. Anything that you think you, an individual, or your team deserve some credit for. To give people hopefully some time to get at least one additional thing, because Morgan has kindly helped us out with that. I'm going to ask Phil and Simon, is there anything you want to reflect upon 2025?
I've got, I think we've made real strides this year, particularly in how we manage patients who are going home on a complex pathway. So people have heard me talk about this. So no criteria to reside numbers. We had over 140 patients last year in the hospital with no criteria to reside. We've got that down to about 60 at the minute. So
what does no criteria to reside? What
so
does
that's
no
people
criteria
who,
to reside mean?
So that's basically people who are medically fit for discharge, is the old-fashioned term to use that. But we've done a lot of work to reduce that over the last year. So I think that's an area that I'd be really proud of. And I think, as I've touched on in my performance slides, the faster diagnosis standard, I think that's one that's really important for patients. We give them a diagnosis in a timely way, and we're doing really, really well with that. One of the best performers. So I think that's really something to be proud of.
Thank you, Phil.
Yeah, it's always hard to single people or areas out on, isn't it? I think so. My first point will be I'm just overwhelmingly impressed by how people manage to do things over and above their job anyway. You've already referenced how tough and busy it is. So any sort of improvement work always amazes me that people have got that drive, dedication, find the time to do it. So that's a thanks to all of you. But if I pick a couple of examples, I think the maternity triage team who have relocated and worked to improve their admission and triage pathway based on feedback from families, staff. I think that's really impressed me. And I think, the emergency department, we're all aware of the pressure they face. So it'd be easy to do nothing but deal with what's in front of them. But some of the things they try to do, the transitional care unit, which is a different way of working, changing the streaming pathways. And they're always looking at ways to improve the things they can influence and can make better. So I think, that always impresses me that people still all that drive, passion and desire to make their area better for their patients ultimately, and also for each other.
Wonderful. Thank you, Phil, and Claire, thank you so much for not leaving me completely hanging on this one. Histopathology achieved NHSE digital transformation target of 50% digital pathology reporting, now around 90%. That's remarkable. I say that genuinely. That is above pretty much every trust in the country. I mean, you think a few years ago where we were with that, it's a remarkable achievement. So thank you, Claire. Thank you, team. And again, fits very neatly with where we want to go, both digitally and otherwise. Patrick, thank you. The pharmacy team have established a network of sexual safety champions. Again, a fundamental part of what we want to be as a trust. We recognise we have challenges across the NHS and the country, and we want to be at the forefront of doing things in the right way. So well done to our pharmacy team to that end. And again, Patrick, thank you for sharing. And thank you also for sharing earlier on that I'd missed that we can share the flu vaccine with inpatients as well as outpatients, particularly those that have been in the hospital for a long time. So thank you. We know we have teams like histopathology, pharmacy teams, and many others across the organisation that that none of the organisation runs without. None of the organisation runs without what you all do. So we're incredibly grateful for what you all do. I'm going to, I wrote in my blog last week about a load of things that we achieved over the last year, including you achieved over the last year, the CRF, CDC, some of the build works that's gone on, the progress we've made digitally, the culture that you still continue to show amazing things across the trust. The thing for me, look, I've only been here 2 months, so none of these are my achievements. They're all your achievements, and they will be next year as well. The culture that you've created here is remarkable. And I mean that for all, whatever it is, 100 or so people on this call and the thousands of people across the organisation. It's the thing that we must build everything else upon, that quality of care, that access of care and everything. And I will do everything I can to support you on that, of building upon that culture that you have here at Sherwood Forest and we have here at Sherwood Forest. We need to treat it incredibly preciously, and we need to make sure that we cherish it, because it's a very special place, and I feel really privileged to be a part of the team here. I've talked a lot, and again, I won't, you'll hear me talk again about this, that balance of realism about where we are and the challenges that, you know, the country and the NHS is facing day to day at the moment. And also the ambition and the excitement about where we can go as an organisation. Be that some of the, you know, we've talked about the digital journey we're going to be on over the next 12, 18, 24 months. The same with how we work with partners, the same with the ambition for where we want our services to go. Again, Simon's already spoken about that very clear ambition, and not just an ambition and a plan to bring down our waiting list. The same for us moving to electronic patient records. Same for us with our UEC pathways and otherwise. And that's what I want you to hold us to, and us to hold each other to, is that realism and that ambition about where we want to go for our colleagues and our patients across our sites and services. So thank you for what you're doing. I think you should be very proud of what you achieved this year, and we need to do more in 2026. I've had some more well dones in. I'm delighted with that. So Jacqueline, thank you. Well done to the teams in pathology for riding out the transition to WinPath version 5. From WinPath version 5 to WinPath Enterprise, and I'm hoping I'm pronouncing this right, Third and Ultra. It hasn't been plain sailing, but our patients have safer, more secure and robust limbs, managing their precious samples. LIMS, I think, Laboratory Information Management System. So it's basically what our labs use to manage their digital systems. Thank you, Jacqueline. It's incredibly impressive and a massive project. Again, Dan from NHIS, again, another fundamental part of our organisation. Again, NHIS colleagues support us from the help desk and everything else across the piece, from updating to Windows 11. Cyber security, which everyone read about in the media. It's one of the things you only know when you don't know about cybersecurity, when it's going well, because and the teams have managed to go through again another challenging year to that end, and a lot of IT projects as well. So again, he says thank you, but I agree with that. NHIS are a key part of our team. They do an amazing job for us, and we're very lucky to have them. So well done to everyone in NHIS, and credit to the PFDS team, reaching 200,000 patients registered to Patients Know Best portal earlier in the year. I referenced the pelvic team, pelvic physio team earlier on. They were telling me that they use Patient Knows Best, and it's on track to hit 250,000 next year. That's amazing. So 200,000 patients can access their health online, look at their hospital letters and access, and of course that helps our access, it helps financial position and everything else therein. So well done. And Tyler, thank you for flagging that. Look, if nothing else, these things have cheered me up today. I think it's amazing the stuff that goes on across all of our sites and services. We're very lucky to be working with you all. And we should, alongside the challenges, we should make sure we celebrate the amazing things that are going on every day. If I might ask one thing of you today, which again, you can choose whether you do this or not, I would ask you over the next couple of days ideally, but if not, let's aim for the new by the new year. Say thank you to one person that's made a difference to you either this week or this month, that you think has just made you feel a bit better, or has done something good, or has done something nice for the team, or you think perhaps goes underappreciated and you haven't said thank you to. Please do that, because I do think sometimes, given how busy it is, we can forget to do that. I'm sure you don't. I'm going to close us there today, but as ever, and as it's Christmas, I'm going to go a little bit off piste at the end. Phil and Simon, what are your favourite item? What is your favourite item on a Christmas dinner, please? Phil.
Well, looking at my face, pigs in blankets.
Thank you, pigs in blankets. We'll just take the answer.
Turkey.
Phil.
Turkey.
Turkey.
The main bit, best bit.
Some people say turkey's like, not a big fan of turkey. It's dry. You don't think so, Phil?
Decent gravy, that's the key, I think. But it's
Good
not dry.
stuff. Fan of a roast carrot myself, controversially. Whatever you're doing this Christmas, I hope you have an amazing time. Thank you for everything you've done this year. If you are working, thank you so much. And I hope to see you around. If not, make sure you have a wonderful break, and happy Christmas, happy New Year. I'll see you soon. Thank you.